Hi there, I'm Dr. Jen, and I wanted to share with you the information we're able to get from the brain mapping that we do in our office for neurofeedback therapy. First of all, the process begins with a QEEG analysis, or a quantitative electroencephalography, which is a non-invasive, safe way to read and record your brainwave activity. The patient will wear a cap like this with multiple sensors on it, which is connected to the computer and allows the software to read your brainwaves. After this is completed, a report is generated. This is our summary map page. The top corner here shows us the four most dysregulated sites of the brain in red that the QEEG recorded. These are the sites we focus on when doing the brain training. With this person, the training will focus on areas for short-term memory, problem solving, attention, and visual processing. Next to this are the global dysregulation meters. These meters measure delta, theta, alpha, and beta brain waves. A healthy, regulated brain is able to shift between processing speeds easily, allowing for better communication and brain function. However, some people have or develop a dysregulation of these brain waves due to things like toxins, past trauma, and stress, which can lead to issues with focus, memory, mood, sleep, and even behavioral patterns such as impulse control and addiction. Brain mapping is not considered a diagnostic tool, but you'll find that the findings will typically be reflective of your symptoms. With a condition like ADHD, for example, you will typically see dysregulation with your delta and theta brain waves. When someone is struggling from depression or anger, you'll typically see a dysregulation of the alpha brain waves. And with anxiety, panic attacks, or excessive worrying, you'll typically see a dysregulation in the beta brain waves. The next part of the report is the focal site dysregulation, which relates to the specific sites of the brain and their functions. The first column shows the severity of the symptoms that are reported by the patient, and the second column is what is detected by the brain mapping. The section here looks at your nervous system function, mental and emotional well-being, and critical thinking and reasoning. The EEG takes multiple readings over the course of about 20 minutes and looks at several dimensions of your brain waves, as shown here. Then all of this is factored into your brain training protocol. Each person's protocol is specific to their findings, and a plan of care is tailored towards their own individual needs. This is what training looks like. The patient will be seated comfortably, watching a 30-minute show or movie with a couple of sensors attached to their head and their ears, which are then connected to the computer. This allows the software to read and analyze their brain waves as they watch the program. The training uses non-invasive audiovisual signals during the therapy to guide the dysregulated brain waves into a more healthy, normal pattern. So over time, as your brain develops new neuronal pathways, it strengthens the prefrontal cortex of the brain, improving focus, attention, impulse control, emotional regulation, and cognitive flexibility. If you would like to schedule an assessment for you or your child, or if you have any questions regarding neurofeedback therapy, please feel free to reach out to us.